Hello everybody, welcome to the webinar for the Disabled Student Survey. I can see that we're starting to get lots of you join us today, so that's absolutely fantastic. We really welcome you to the session and it's brilliant to have you here joining in and listening. So the webinar today will be exploring the experiences of students across the UK. So just a little bit of administration before we start. So we do have closed captions for this session. And if you'd like to access those, you may just have to go to the remote controls on the screen and click to turn on closed captions. We ask that the Q&As that you may have are put in the Q&A box. What we'll do is we'll do a little bit of an overview of the report and hear from some of the authors and some of the contributors. And then we'll move on to kind of a discussion in the Q&A. So if you have anything that comes to mind during the session, please do pop it in the Q&A box and we'll come to it towards the end of the session. We have turned off the chat box for all participants during the session itself, and that just means that it's not read out by screen readers, so hopefully it won't be disruptive for anybody. The session is being recorded and a transcript will be available at the end of the session. And if you are looking for BSL, if you just go to the your controls and select gallery view, you'll then be able to view the speakers and also the BSL interpreters as well. Okay, so the Disabled Student Survey. The purpose of this survey was really to explore experiences of students across the UK. And the report itself was launched on Monday by the GDI Hub and the Snowdon Trust. And it was really looking at bringing kind of new insights into the disabled student experience, with a real focus on hearing those student voices, but also looking at some areas that maybe hadn't been captured in previous reports. For example, the impact of COVID-19, the COVID-19 pandemic, both on study and learning experiences. So just to give you a bit of context, really, the Global Disability Innovation Hub and Snowden have been working together since 2019, and we run a Snowden Master Scholarship Programme, which supports students with up to £30,000 of funding to take part in UK-based master's programmes. So we've got an exceptional group of disabled leaders that for the last few years have been going through that process and are studying at universities right across the country, or have now graduated and moving on to their careers and into the workplace. We've seen through this, we've had a really large volume of really exceptional disabled students at different stages of their careers and their studies. And we very much heard through that there were common challenges and barriers in access to and opportunities around higher education, but also then some of those transitions into the workplace as well. So I guess that movement between education and the next stage. So every 7 years, the Snowdon Trust conducts a survey of scholars and students, really just looking into some of these key priorities and some of the key challenges around university life, but also more wider into kind of different areas of impact of access for students, and looking into things such as finance as well. So that's how the survey came about, and really it was an opportunity to just hear from students right across the country currently studying or who had graduated in the last few years, just to find out, I guess, what the current environment was like, and to see if those trends that had been really present in the past were still prominent, but also to understand a little bit more around the impact of new ways of learning and digital changes as well. So I'll now hand you across to Vicki Austin, who's the CEO of the GDI Hub.
Good morning, everyone. It's a pleasure to be here and a pleasure to be in such great company with the speakers today. I'm Vicki Austin. I'm the Chief Exec and co-founder of GDI Hub. And for those of you that don't know, the Global Disability Innovation Hub is a research and practice centre, a think and do tank, if you like, based out of UCL in East London. And we grew out of the legacy of the Paralympic Games in 2012. Our projects are now in about 35 countries, and we work with 70 or 80 partners delivering programmes of about £50 million in total. And we do that to drive disability innovation for a fairer world. We're all passionately committed to creating fairer opportunities for disabled people around the world, and education is an absolutely vital part of that process. So it's a pleasure to be able to be part of the launch of such an important report today. And I'm filled with excitement, not just because the report was produced in collaboration with the Snowdon Trust, who we've enjoyed a fantastic relationship with for the past couple of years, but also because it's drawing out some really important lessons and points that it's now time to be mindful of. I think especially given the challenges that we've all faced over the previous year, now is definitely the time to ensure that everybody has the opportunity they need to drive towards the change they want to see, both in their own lives and collectively. And so the issues that this report raises, not just about investment, though that's really important, but also about how that investment is accessed and the burden of administration that is falling to individuals. And some of those individuals potentially have more barriers to accessing the administration. And so it's important that policymakers and advocates and universities think about not just what's available to be accessed by disabled students, but also how those resources are accessible too. I know that others are going to talk in more detail, so I'm looking forward to hearing from them. But on behalf of the GDI Hub, I'd just like to say that we're really proud of this piece of work, and we're really grateful for the support of Snowdon Trust and also Paul Alexander before he left, and Paul Natulia before he left us too, in pulling this together. So thank you very much.
Excellent. Thank you for that introduction, Vicki. I'm now going to hand across to Helen from the Snowdon Trust.
Hi everyone, I'm Helen Salins-Minder. I'm Chief Executive at the Snowdon Trust, having been in post for a matter of months now, and as Vicki mentioned, took over from Paul Alexander in the role halfway through this project. Now, having seen Vicki's slide, I can tell you we work at a slightly smaller scale than the GDI Hub, and I'm not sure we'll ever be able to say we've impacted on 12 million people. But we're happy that the very small contribution that we make has a huge impact for the students we help. And so just to give you a bit of background to the Snowdon Trust and why we commissioned the survey, research actually has been pretty central to us from the outset. And we were established by the first Earl of Snowdon as a direct result of the cross-government review he completed in the 1970s about the integration of disabled people and the subsequent report that emerged from that. And one of the things that it highlighted was that there was a real link between lack of access to post-16 education for disabled young people and the impact of that on their future life opportunities. And so he established the trust to provide grants which covered the expense of disability-related study costs and would put disabled students on an equal financial footing with their non-disabled peers. And actually, he felt that there wouldn't be any longevity to our trust. He felt that within 20 years, Equality Action would take over the need for our grants programme. So there's something slightly uncomfortable about the fact that we'll celebrate our 40th anniversary this year. And while we recognise that there's been huge improvements in statutory funding opportunities for students, we recognise that it doesn't meet the full need of some students, and we'll always continue to be there to support that. But we've also become really clear that actually that financial disparity is not the only obstacle in education and the transition to employment, and that's why we've established the Snowden Masters Scholarships, and that was really about a recognition that in too many company boardrooms there weren't enough disabled people represented. And so the Snowden Scholarships are designed to accelerate the most talented students through their studies, really to become the influencers of the future. And as Louise touched on, we have met some extraordinary students through that process. And I'm really excited about the drive for change I'm certain that they're going to achieve in their workplaces. And we add value to that programme by having established the Disabled Leaders Network, which is a platform for peer support and networking and collaboration for those students. And Louise has been running that for us for the last year or so. And as with all things, COVID turned all of our plans for that network upside down initially. But we're really investing in that space as an opportunity for future leaders to really share good practice and collaborate, learn from each other, and grow their collective influence. And as a tiny organisation with really big ambitions for our students, we find that we need to manage our ability to deliver everything we want to by working in partnership with other organisations. And we've enjoyed a really excellent partnership with GDI managing our scholarship programme, and so it was natural to come to them to talk about delivering the survey this year. And as we came together to agree the parameters, it was clear that coming alongside the Higher Education Commission report, this was just a really important opportunity to add a narrative to those report recommendations that really spoke about the obstacles being faced by students in their own words. And I think that they have brought those real issues to life brilliantly. And I'm really glad that those stories are now in the public, and not only do we hope that they influence policymakers in the way that they should, but they're also helping to influence our own strategic direction as an organisation and make sure that our grants are set up to help students in the way that they need to. And finally, I just want to say an enormous thank you to the Boshier Hinton Foundation, who've long been a supporter of the Snowdon Trust. But when we approached them about this particular project, they immediately saw the value and made an exceptional grant to us to fund it in full. And so I want to say an enormous thank you to them. Thanks.
Thank you, Helen. So we're just going to now go on just to look at some of the details of the report itself, just to give everybody a little bit more of an overview of the context. We had a total of 236 students and graduates respond to the survey from 60 different institutions from right across the UK, and studying a real range and variety of subjects. 190 of those were still studying, 70 of whom will graduate this coming year, and another 120 who will graduate in the following years. Of that amount, we had 65% studying undergraduate and 35% doing postgrad, and 50% had 2 or more disabilities, which was something that came through quite strongly through all of the work. And when we asked about which factors affected people's university experience, it was certainly disability, which was the highest for the respondents of the survey. And I think that just this quote for us quite well summarised, I guess, some people's kind of responses to the survey when we first released it. And this is a quote which just says, "Thank you for this survey. I felt it was fine. I was finally ready to get out some of these emotions and thoughts in a good way, and hopefully for them to be heard." And I think that's quite a reflection on what many of the respondents to the survey fed back to us, and that actually they maybe had quite a few individual frustrations within their experiences, but also some really positive experiences as well. And actually it was an opportunity to share some of those best practices, but also some of the challenges that are still in place but could be resolved moving forward for other students. So we identified across this work that there were 6 key challenges. And I guess this is kind of what we framed the survey around and really looked to explore in a bit more detail. And that was that funding is quite fragmented and often really inflexible, and that's based around geographic location, and therefore there's different shortfalls in support depending on where you are based across the country. Accessible accommodation options are very often limited and expensive, with challenges across both the university markets themselves, but also the private sector. The administrative burden, which has already been somewhat reflected on during this discussion so far, was something that was really highlighted throughout in terms of the impact it has on kind of stress and anguish levels, but also taking that really valuable time away from study and social life. So all those other elements that you would anticipate from a university experience are really impacted by that. We also discovered that a lot of students responded to let us know that actually assistive technology is often not currently meeting student needs, and that's to do with barriers around the costs but also very much around the expertise and access and training involved in actually making the best use of the right assistive technology for the right students. Social activities came through quite strongly as being something that is often inaccessible, really limiting some of opportunities for students to engage in that full range of life, of student life, but also then looking into transition to employment. Many students felt they were quite daunted by that next stage, and actually some of the challenges and experiences they faced at maybe the educational level would then be continued on as they moved into the workplace. So it was really looking at some of those challenges and how to navigate that next step. So across the results of the survey and looking really at the key themes that came through, the first theme that came around was the real need for a unified approach. So that's really looking at how funding is fragmented across kind of student finances, local authorities, and individual universities, and there's real inconsistency in provision and process. So our recommendation around that was looking at the government to implement a unified funding system to overcome some of those regional disparities and try and provide adequate support so that we get a really kind of equitable student experience. The second theme was around removing of barriers. So I think that was really focused around the ongoing cumulative burden of the additional challenges from affordable accommodation to assistive technology and how that impacts students' ability to engage across university experiences. And the real recommendations around that were for universities to provide kind of affordable, accessible accommodation with options available as well, which I think is really key. And also from a governmental perspective, to look at how assistive technology can be adequately provided across universities using suitable technologies, but also appropriate training so that actually those assistive technologies are used most effectively as they can be. The third theme was around streamlining systems. So that was really looking at improved communication between students, university departments, fundraising streams, and really trying to overcome some of those time-consuming and really mentally draining challenges that some students were experiencing. And so some of the recommendations around that were around universities assigning one point of contact for disabled students. So that has more of a liaison role across departments and supervisors. And also looking at the value of the government implementing kind of funding navigators to advise and support disabled students through a very kind of vast and complicated public funding application processes. The fourth theme was about kind of equitable experience. So really that's looking at the importance of kind of university leadership having a championing role and understanding the importance of access across kind of social and academic planning to meet a really kind of diverse needs of the student population. And really the recommendation around that was looking at kind of student unions or the backing of that leadership to make some social changes around and some cultural changes, I guess, to equip societies with the knowledge and the means to implement things such as accessible social calendars and moving into kind of Freshers Week and stuff like that. The fifth theme was around holistic outcomes. So really that was looking at a need to tailor support to maximise outcomes and the implementation of assistive technology and streamlining transitions into the workplace. So that was really looking at an idea that came up from quite a lot of our respondents around the need for kind of a centralised hub of information to support disabled students through that onward journey. So that's drawing on kind of expertise from across university, but also within peers that have already gone through that process and the kind of disability and employment sector. And the sixth one was around the individual, and really that was a concept and kind of results that came through throughout the survey and the different sections within that was the need for a flexible and individualised approach. And that was really evident through some of the responses around COVID-19, which showed that that had very different impacts on different students around different impairments, but also subjects and a kind of accessibility of courses. And actually that showed that actually having that adaptable and I guess flexible approach to learning can really make a big difference. So I'm just going to finish up with a quote from Matt. We felt this kind of summarised quite a lot of the opinion that was coming through from students through the report. And he just said, the thing I would most like you to take away from this is that there are so many bureaucratic barriers, and these bureaucratic barriers form such a substantial determining part of the disabled student experience. And I feel that summarizes quite a lot of the feedback we had from students, is that actually it's not necessarily one individual challenge that causes the biggest problem within this space. It's actually the volume of individual smaller barriers that are in place, and that the continuation of having to kind of self-advocate to overcome those, that becomes a bigger barrier than the individual challenges themselves. So I'm now going to hand across to my colleague Kate, who is doing a lot of the lead work on the research element of this piece, just to talk us through some of the more detailed results across some of the key sections of the report.
Thanks, Louise. Hello, everybody. I'm Kate. So I'm just going to run through some of the different sections, as Louise said. So start off with funding. From the survey respondents, we found that 87% had felt that their disability created a greater financial challenge than their non-disabled peers. 44% felt more available funding would have made the biggest difference to their university experience, and 24% of those who received charitable funding said that they would not have been able to attend university without it. In terms of the application process for funding, 41% reported that they needed additional support just to help navigate the complicated funding process, and 39% said that the administrative burden of applying for funding put them off attempting to even access it. Next slide, please, Louise. So one student remarked, "If I am honest, the system is very complicated. The university pays for some, the local authority pays for some, DSA funds some. It can be pretty complicated. And when you've got pots of money everywhere, to be honest, I don't always know who should be paying for what. The system as a whole is complex to navigate." Next slide, please. In terms of the accommodation, 11% of respondents reported that the accommodation on offer contributed to their university choice, which seems significant when you think about universities trying to recruit students. Accommodation was often the greatest financial shortfall. Many students expressed their frustrations at the additional costs, lack of choice for accessible options, and the impact this then had on social interactions. The greatest costs were incurred by some students who needed extra space for their mobility equipment or an extra room for a personal assistant. Some students received additional support from local authorities, whilst others faced rejection. Next slide, please. And this is a good quote that I thought summed it up well. "Accessible college accommodation is a lot more expensive than standard college accommodation or private accommodation. I spend about 65% of my PhD stipend on rent." In terms of the administrative burden, bureaucratic challenges created an immense amount of administrative tasks, with obstacles spanning the entire university journey, from the application process to accessing funding, sourcing support, and then the continuous self-advocacy that was required just to ensure that these access needs were implemented. 43% of disabled students said that they had spent more time on these tasks than they had expected. And a quote from this: "I found it frustrating that different parts of the university did not talk to each other about my requirements, so I often found myself having to explain myself from scratch." And that was something that we found a lot, this constant kind of repetition that students had to do. Next slide, please. In terms of the assistive technology, financial and administrative frustrations related to assistive technology. The self-funding of expensive equipment created these additional financial burdens for students, and additional administrative tasks included chasing the funding, securing training, and implementing assistive technology into their course delivery. Once students had managed to get receipt of the equipment, training then took time to organise and was often inadequate. Students were left at a disadvantage of not being able to use a piece of equipment that they had been granted. And 24% of students reported here that there were shortfalls in public funding for study equipment. And Fahana said, "I was provided a Braille display that came from one provider, and then another provider delivered the training. It wasn't adequate for me to know how to use it. She found it such a waste for an expensive piece of equipment to just be sitting there." In terms of the social activities, many students emphasised how the time that was taken on these administrative tasks reduced their ability to then participate socially. Students expressed the injustice of these access barriers, and 46% scored Freshers Week just 3 or less out of 10 for accessibility. 40% felt their time to join a group was limited due to medical or health commitments, and 30% had wanted to join a group, but just felt they were not accessible. And once again, here's a quote from Farhana, who is a student with a visual impairment, and explains her circumstance in Freshers Week. Everyone else around you is having a splendid time. They're exploring the city, going out, whatever it might be, and you're stuck in your room because you don't know how to get to places. In terms of the transition post-university, respondents expressed how more joined up thinking between DSA, universities, access to work, and wider sector organisations could help transition to employment. 78% felt that higher education had led them closer to their dream aspirations. 68% believed there will be many challenges when entering the workplace because it was felt to not be inclusive. 53% said career services were helpful and tailored specifically to meet student needs, but 45% said that the career services was just not helpful. One student suggested that there needs to be preparation for disabled graduates for the minefield of reasonable adjustments and access to work so that we can start our careers on an equal footing. In terms of COVID-19, the move to online learning has been positive for some disabled students, enabling greater flexibility around when, where, and how to study. But some students reported that there are multiple challenges with multitasking during online sessions, and individuals with sensory impairments reported a mixed experience of the online learning. There was quite a divide about whether it was kind of positive or negative. So 54% found digital teaching to be a negative experience, versus 45% had found it to be a positive experience. We found that 38% of those who had a positive digital learning experience identified as having a mobility difficulty, and many commented positively on the reduced physical demand that working virtually had then allowed. And this is a quote that kind of summarizes that. I love online lectures because it saves a lot of time and mental energy going in. Smaller lab classes are amazing. So to talk about the Snowdon Trust support, many had expressed how the funding had given them the opportunity to pursue goals that were otherwise unachievable. 90% felt Snowdon Trust funding had enabled them to get more out of their university experience. 82% felt that Snowdon Trust had given them confidence in their abilities. And 74% said that without Snowdon Trust, they would not have been able to attend university. 68% felt Snowdon Trust support enabled them to be involved in the university experience and community. And one student explained, "It changed my life completely. It allowed me to be more independent and I was able to attend so much more at uni. I had choices again and felt like a normal student again."
Excellent. Thank you so much, Kate, for just summarising some of the key, I guess, results from the survey itself. I have to send the apologies. We've had a few bits of feedback that we've been, and particularly me, have been talking too fast. So apologies for that, and we'll try and make sure that we slow down the tempo somewhat. So hopefully you've all got a good understanding of the report itself, and I'm sure many of you have had the opportunity to read it before the session as well, so that's brilliant. I'm now going to hand across to Lucy and let her introduce herself and talk to you a little bit about her experiences.
Hi, thanks ever so much for inviting me. So my name's Lucy Dixon, and I'm currently studying a master's in social research at the University of York. And I thought I'd just give you a little bit of background about myself first, before telling you some of my experiences as a disabled student. So I have a multi-system chronic disease called PCD, which stands for primary ciliary dyskinesia. And it's quite a rare disease, and it affects mostly the lungs, the sinuses, the ears, all of your airways, and also other things like your fertility and your general health. And PCD causes recurrent respiratory infections, which means I will spend about 2 to 8 weeks a year in hospital having intravenous antibiotics to try and get rid of these infections. And it also has a very high treatment burden, which means I spend about 4 hours, 3.5 to 4 hours a day doing lots of physiotherapy to clear my lungs. And the problem is that I get pathogens and mucus build up in my lungs and my ears and nose, and that causes irreversible damage. So I will give you a little bit of a background to my educational journey. So I was born with PCD, the condition, and I have always had sort of repeated episodes of illness. But I ended up doing my undergraduate degree at Cambridge University, and during this time I had lots more infection than I was used to. So I'll just talk to you about the pictures at the bottom of this slide, and I will describe them. So the first picture is a picture of me in hospital with what we are now quite used to, a face mask on, with a cannula in my hand. And this was actually my first pandemic. This was, I had swine flu, and this was in 2009. And I spent a few weeks in hospital having treatment just around my A-level exams. The second photo is me holding my degree certificate, and this is me graduating from Cambridge University, and that was in 2014. The third photo is a picture of me speaking at the Welsh Assembly government about having a rare disease. And the fourth photo is a little bit more recent. It's from 2019, where I was in hospital for another infection. And since graduating university from my undergraduate degree, I have worked in education, and I've worked to getting disadvantaged students into selective universities, mostly looking at students from minority ethnic backgrounds, but also those with disabilities. But in 2019, I caught a multi-drug resistant infection, and I was just getting too many infections to be able to continue working. So I took a bit of time out to have treatment, and I decided to think about my next career steps. And part of that was understanding that I needed to progress my research skills because I wanted to do more research in the future and move into those kinds of roles. But I didn't have the money to do this. And so I looked to the Snowdon Trust and their Master's Scholarship Programme to help me out. And this has absolutely changed my life. And I started my master's degree in September. Now, the pandemic had obviously started by this point, and I was one of the 4 million people in Britain who were deemed clinically extremely vulnerable, which meant that we had to be extremely careful about not getting COVID. And so for a couple of months, I didn't see anybody, and I lived mostly on my own and doing all my care on my own. But then after several months of this, I decided to move up to York to start my master's, and I was reassured by the university that it would be a safe environment and that they had taken lots of measures to make sure that COVID was controlled and that all the students were safe. But when I got there, my experience was slightly different. The problem with my disability, I think, is that it's quite invisible and it's inconsistent. So I have a basket of things here, which are part of my daily treatment. But when you see me, you can't really work out what is going on. I have usually a very loud cough, and I often sound like I have a cold. And so it was very hard for people to really understand the inconsistencies and invisibility of my illness. And that meant that when people were putting in preparations, it was a little bit hard to know what I needed. Although I would argue that I was very clear about what I needed. Now, the postcode lottery of disability services is something that I think I can see in some of the comments in the chat other people are talking about, that it's not equal. So depending on where you go to university often determines what kind of access to support you have. And this can be really frustrating. And I definitely thought that my undergraduate experience would translate equally to my graduate experience. But what the reality was that I started from scratch. I had to explain my condition, I had to have assessments, and even still, I felt that I was having to repeat myself constantly. And then part of the problem around this for me was the student support plan. So in my student support plan, it mentions shielding and clinically extremely vulnerable at least 4 times. But when the cases started to go up on campus and I said I needed to shield again, I could move online immediately. I could move my teaching online immediately and didn't need to go in person. But what I couldn't do was get food, get laundry, get access to books. Everything that needed human support seemed to not be set up. And I spent a couple of weeks trying to get this set up, and I was passed around different members of the university before it just became so overwhelming that I decided to move home and rely on my parents for the support. So I think there's lots of issues that the pandemic has brought up, and I hope that future disability services are going to look at these more closely and really try and translate people's student support plans into help for disabled students that really is tailored to their condition, and that hopefully we can narrow down these processes where we don't have to repeat ourselves constantly. I'm going to just conclude with one quick point, which is I think there are many reasons to be optimistic about the changes that the pandemic has brought to people with disabilities. And for someone with a chronic condition like myself, one of the things that I'm grateful for is that I think when more and more employers are changing to flexible working arrangements. So in the first 6 years of working after my undergrad, I found it was very hard to say I would like to work from home this many days a week. It just wasn't very easy. Now that's becoming more ingrained in culture. And that's something that I think we can take away from this with a point of optimism. I just wanted to end on saying a huge thank you to the Snowdon Trust. I absolutely wouldn't be able to be studying without you guys, and this scholarship has completely changed my life. So I'm very, very grateful. I'm very grateful to be involved in this great bit of research. Thank you.
Thank you so much, Lucy. I think that was a really excellent overview, I guess, of kind of some of those individual challenges, which are impairment related, but also elements that will affect many, many people, I'm sure, who completed the survey and also are joining today, and just how all those different challenges can combine and put some real barriers in place. But it's really brilliant to hear kind of how it's all been going and the impact of the Snowden Scholarship. And we're really proud to have you on board as a Snowden Scholar. So thank you so much for joining the session and for telling us all that. I know we've had some questions come in for Lucy, and what we'll do is we'll kind of summarize and finish up the core presentation, and then we'll come to the kind of Q&A point. So if anyone else has anything else they'd like to ask Lucy directly, do pop it in the Q&A. We're now going to move on to hear from Finis. I will hand across to Finis himself so he can introduce himself and tell you a little bit more about him.
Thank you, Louise, and what an act to follow after Lucy. So I will try my best, but we will see how it goes. Good afternoon, everyone. As Louise said, my name is Tinez. I'm 27, and I am a graduate of UCL, University College London. I graduated in 2018, and since then I have worked in a number of organizations in the health sector, and now I'm a civil servant on the graduate civil service fast stream. Similar to Lucy, I have a genetic rare disease known as osteogenesis imperfecta, or Burrow bone disease. It's a rare congenital disease that has meant that I've had in excess of 200 fractures in my short 27 years of life, which meant that up until the age of 16, I had spent less than 24 months cumulatively in school with my peers. So when I got the opportunity and chance to go to university and to attend UCL, I chose to grab onto it with both arms and to really make the most of that experience. When I got there, over the 5 years of my degree, I found it to be the most exhilarating, life-changing and life-affirming experience that I've ever had, and I would never change it for the world. There are definitely a range of good and not so good experiences, but it has definitely formulated the individual that I am today, and the work that I get involved in, and the things that I want to do going forward in my career, in my advocacy, and in my career to support those who are, in a similar situation, and to ensure that some of the negative experiences or areas which I saw improvement is worked on and improved for future students and future scholars. During my time at UCL, I was the Disabled Students Officer in 2014 and 15, and I helped start the conversations with the senior leaders about how truly physically accessible our campus was, because someone with a physical disability, that was where I was having most of my barriers and issues. And as we've heard from some of the previous speakers, that's some of the areas that there were some key barriers identified through the survey as well. And then that highlighted some really key areas around accommodation and around funding and around the need for greater accountability from senior leadership to take action and to take ownership of some of the issues that have been reported by disabled students for many a year. Over the pandemic, I have unfortunately been shielding as well, similar to Lucy, over the last 18 months while I wait for surgery. So I've been bedbound, which is why I'm presenting from in bed, not being lazy. And I'm still waiting surgery to come forward when it is safe for me to go in for that procedure. So that has given me an insight and an ability to sort of see what the impact of remote learning, remote working, and what that sort of looks like from an employee's perspective, but also in the mentoring work that I've been doing with students at UCL. I've also had an insight into that as well. So what have been some of the positives that I've sort of teased out as a result of remote learning and remote working? Well, within the education sphere, I can say that, there's been now the widespread implementation of lecturecast and lecture capture used as standard for recording and capturing seminars, which has been a long requested feature. We've also seen the normalization of take-home exams as standard practice to enable those who may be not able to sit exams in exam halls or who may need extra adjustments in order to participate in exams. We've seen this become more normal practice, which has allowed for greater participation. For example, when I was at university, I found it quite difficult at times to engage in exams or to engage in classes due to my varying health needs and varying health things at various times in the year. So something like this would have been really supportive and really improved my student experience when I was a student. And one of the things that one of my mentees has reflected is the fact that down to remote working, it has allowed her to be a better management of her own time and her energies, and is able to engage with work when she feels she's the most able and comfortable to do so, which can only be a good thing. As the survey has also reflected, remote working and remote learning has also not worked for some, and that there are reasons why it would be understandable when it comes to social isolation and mental health and well-being. That has been a big thing that I have experienced, being someone who's been shielding for a year. I have been relying on tech as my main way of interacting with the outside world. It can sometimes be an isolating experience. So I think this is where there is great opportunities for universities, for students, clubs and societies, and for other mechanisms within the universities and the education sphere to really step up and ensure greater inclusion and greater support and greater awareness to facilitate this. So where do I see the role of universities and going forward in this? I think, as with the rest of the world, we've seen higher education and university institutions respond very agilely and very quickly to the changing needs required by COVID. And we have seen things achieved in the space of a very short amount of time, within a few weeks, in fact, on matters that have been requested and asked for a number of years. So I think we need to keep holding universities to account to keep up with this level of innovation, to keep up with keeping up with the asks and needs of students and staff who may have disabilities or not. And we also need to be ensuring that universities are working well with their mental health and well-being liaisons and psychological services to ensure that these services become available and are made as easily accessible and available virtually as they are in person, and also capitalizing on the fact that you can more easily provide the support virtually, making sure that we provide that, and also ensuring that we don't use this ability to provide learning virtually as an excuse not to develop more opportunities and more accessible and affordable accommodation options for disabled students. Just because disabled students can now engage with materials from wherever they are or from home doesn't mean that they should be excluded from being able to be on campus in accessible, affordable accommodation that they can make use of. And one of the last things I wanted to reflect on was it's important to allow for a single point of contact to ensure that disabled students and others who may need to follow up with various matters with their institution are able to. That is much easier when you are able to be there in person, even though that is a burden. At least you can physically go up and consult, ask, follow up. But when working in a remote environment, that has become more difficult. So using resources that universities, institutions have to allow for that single point of contact will be really useful. And I like to end, as with Lucy, on an optimistic note. I think this is a real opportunity for us to do different, to be better, to work collaboratively with our partners, with the universities, taking into account clubs and societies and other third sector organizations and other organizations that are interested in this space, as well as disabled students groups, to become and stay as inclusive as possible. Because when we make things as accessible as possible for those who are the most affected, we make things easier and more accessible to everyone as a whole. So thank you, everyone, and I will pass back over.
Thank you so much for that. Really, really interesting just to hear all your reflections. And I think particularly that focus on the opportunities moving forward and where we've had learnings from the past year, but also wider than that in terms of the value of technology and the ongoing benefit, but potentially also as well some of the I guess some of the challenges we need to be aware around that, to make sure that actually the priority moving forward is for an equitable student experience, and that a lot of energy is put into ensuring that actually that goes across study right through to social and all the other elements that make up student life as well. So thank you so much for that overview. It's been really, really interesting to hear from you and just hear about your role and experience while at university and beyond as well. So I'm just going to move on now to introduce Amelia from Disabled Students UK. So Amelia, I'll leave you to tell us a bit more about yourself and the work that you're doing at Disabled Students UK.
Thank you so much. So firstly, I would like to thank Global Disability Innovation Hub for inviting us to speak today and to be part of the launch of a very welcome student-centred report, which we wholeheartedly support. Next slide. Thank you. As an introduction, my name is Amelia McLaughlin and I'm the Network Director at Disabled Students UK. Disabled Students UK is a community interest company that is completely led by disabled students, either those still studying at university or recent graduates. Our collective has 400 contributors from 60 different universities, and our activity spans research, policy, consulting, and student voice work. We can be reached via our website or on Twitter. Next slide. Thanks. In terms of the biggest challenges facing disabled students, I can share with you some findings from our own COVID-19 survey. Some of these are echoed in the report that we're talking about today, especially in terms of the administrative burden. So in our report, 60% of students felt that they had less capacity to go through the processes, and 37% had been asked to provide medical evidence for their disability-related needs, regardless of the fact that they had already provided this evidence to the university, stating their disability and their disclosure. 42% of our participants stated that they struggled with acquiring this medical evidence during the pandemic, and 43% felt that the whole process of acquiring disability support had been slowed down or put on hold during the pandemic. This is quite interesting because while one of the other barriers has been learning barriers. So while 93% of participants had received online or distance teaching since the start of the pandemic, learning barriers were still present, with 68% having experienced some kind of issues with that learning or distance learning. There was also a range in institutional responses, with about 28% stating that any issues that they encountered were not addressed by their individual institution. So I think this shows that while it should be said that some disabled students have seen the benefits of online learning, there are still issues in the development and delivery of these services for other students. Potentially more worryingly, I think, further students that had some on-campus teaching, around 57% reported that they felt less safe on campus during the pandemic than before the pandemic. And this was directly linked to the increased COVID risk, inclusive of their disability status, and the fear of backlash from their peers for following COVID guidance. For example, having to wear a mask and having backlash for that, or being unable to wear a mask due to some component of their disability. I think with the continued uncertainty, coupled with some students receiving do not resuscitate orders, and the shocking reality that two-thirds of COVID deaths have been disabled people, perhaps it is no surprise that 83% of our participants stated that their mental health had been worse or much worse during the pandemic. However, with all this being said, I think there is still a key issue that we need to address and learn from. That even though many of the changes we have seen in the sector and have been called for by disabled students have benefited disabled students, these changes were not implemented for disabled students. This distinction is vitally important in understanding why disabled students continue to encounter issues and demonstrates how the sector is still not centering the needs of disabled students, even though we know now that there is a net benefit to all students from this kind of work. Next slide. So in terms of next steps, I return to my personal mantra of see, listen, and learn. The administrative burden can be reduced by seeing if your institutional processes reflect either the medical model or social model of disability. The medical model is often based on proving via medical evidence, increasing admin, and focusing on the individual student as the problem. There is research in disability studies that focuses on this and can help institutions in this review, and not increasing the burden on disabled students to do this work through disclosing their individual experience. However, listening to disabled students is imperative. This report is another example of data and solutions available, but it's important that every higher education institution partner with its disabled students and is led by their experience and expertise. These interactions need to embed safety for disabled students to come forward, be conducted in a neutral and non-personal way, and respect the re-traumatization that explaining lived experience can have. Also, listening should not be a one-off extractive process, but a step towards collaborative learning. Ultimately, universities need to have an open dialogue about the structure and expressions of ableism, developing and implementing systems that evolve with continued involvement of disabled students. And I'm happy to take any questions.
Thank you so much, Amelia. It's really, really interesting just hearing some of those statistics and also just some of the reflections that you've made. And just a few things I wrote down just around that in kind of importance of best practice and the need of individual students. And I think what's come up through the information you've just shared with us, but also in the Q&A box where we've had quite a few questions come in and quite a few people offering their own reflections as well, has been that importance of cultural change and actually how that can be shifted within these very quite large institutions, and what might be the best mechanisms to sharing that best practice and creating that change. And as you said, that importance of having disabled students right at the heart of the change as well, to drive the right change at the right time in the right mechanisms. So I think maybe that's something we'll come on to in the discussion as well, just to hear a little bit more from the rest of the panel on what some of those mechanisms might be in terms of driving forward that change. So I'm just going to quickly just go through this quote that we thought was quite interesting. So overall, 10% of students said university very much met their expectations, but overall, out of 10, their experience rating was just under 7. So I think what we felt from that was that actually disabled students, and it's something that's come up through the report and through the panelists, but also the comments in the Q&A, do find that those additional barriers do reduce the ability to experience all of the full elements of university, be that from the study through to social, through to the other I guess expected life experiences, and obviously COVID has had an impact on that for everybody, but also a particular impact for students that may be shielding or have additional barriers in terms of engaging. So we're next going to move on to the discussion. So the first point we were going to look to ask the panel was, what do you think are the most important next steps for university and decision makers? And I think that quite interestingly sits in with what we were just discussing around that, how do we drive that cultural change? And I know there's been a comment in the Q&As around what would be the potential of, say, a rating system amongst universities, or that information sharing, or potentially a report on a more regular basis, potentially annually, just looking to really track those changes. So I think it would be quite interesting, Lucy, just to come to you and see if you've got any reflections or personal thoughts on that in terms of what you think might be the next steps, and if you would see there being as a quite a clear way for universities to support and help each other to implement this positive change, and how might be the mechanisms to make that happen.
I certainly think that we need a little bit more reflection from our universities, and a little bit more joined up thinking. And I think part of the barriers that seem quite common to many disabled students is the admin burden that we all face. And that's something that, regardless of what kind of disability you have, seems to be such a problem in our ability to just have a smooth student experience. And so I think we do need a kind of very widespread review of how universities cater to their disabled students' needs. And part of this, I think, is to make sure that the voices of disabled students are really heard. And so this survey has been really, really useful in allowing us to feel like that. But I would be interested in other disabled students' experiences at different institutions, because when I've tried to raise these issues of, not being able to get the support or care I need, I feel that there's a culture of passing the buck. So an example of this was, I spoke to disability services about my accommodation not being very suited to my needs. And they said, well, this is an accommodation issue. And I spoke to accommodation about this, and they said, well, this is a disability services issue. So I think that there are so many problems that I think have probably been highlighted more because of the changes that we've had with the pandemic. But really, we need a much more bespoke look at the issues that are being faced by us disabled students, and to really have those voices heard and put into practice to generate a bit of change in all of these processes. Because I think we cannot go on with, having to pass emails, taking time out of our studies because we're constantly emailing just to get the things that we need. And something that I've said before, and I'll round up on this, is you have to do so much just to get to 0. If you have a disability or a chronic health condition, just to get to where everyone else is at, you have to do so much. And I'd love to see that removed by some of these processes.
Thank you, Lucy. And I think that's a really interesting reflection there, just to start to summarise on, is that the importance of that equitable student experience, and actually if we can very much challenge and reduce these barriers, it's going to make a huge difference to the lives of so many people, and actually have a lot of additional benefits as well across the university cohort. So I think that that's a really interesting summary of the challenges and of those important next steps. Finesse has had to go because it's off to an important meeting, which makes me realise that we're coming towards the end of our session. So I just wanted to quickly pull up. There's been quite a few questions from people in the Q&A who have applied to become a Snowden Masters Scholarship holder. So we're just going through the selection process at the moment, so you'll all be contacted very shortly, just to let you know where your applications are up to. And some more questions around what funding opportunities are available through the Snowdon Trust at the moment. So do have a look at the Snowdon Trust website. They offer a number of grants throughout the year to help additional costs, additional disability related costs. So that's worth keeping an eye on. And as Helen mentioned at the start, this report has actually made us all sit back and reflect a little bit more around what some of the needs are as well. So do keep an eye across kind of the GDI Hub and also the Snowdon Trust for kind of updates of information and how we look to grow. And it's been brilliant to hear some of your reflections on the panelists' experiences and also the results of the survey. And we're very much looking to grow out, it's been mentioned a couple of times before, the Disabled Leaders Network, which at the moment is focused around those students that are scholarship holders, but we are looking to bring that open to a much wider audience. So we'd be really welcome for the attendees today to think about joining that network and providing a bit more of a platform for kind of peer-to-peer support and engagement and discussions and different opportunities as well. So we shall provide more information on that to you all, so you'll have that as we move forward. But before we finish, I'd just like to go across to Helen from the Snowdon Trust, just to hear if you've got anything you'd like to reflect on, Helen, from the discussion today or the overall report.
Yeah, thanks, Louise, and an apology to those of you who identified that I was another person guilty of speaking way too fast at the beginning of this this webinar. When we set up this report, we knew it would be important to sort of support our own strategic direction, but we have the feedback that has come out of this has been so absolutely crucial on a much wider scale, and we think we have to think very carefully about the practical support measures that we can put in place to support students. But we just really hope that the results of this report get out into the public where they're needed most, and actually, you know, as the slide says, to really support universities and decision makers to think very carefully about the support measures they need to put in place, and the leadership that they need to devote to that. So really proud of every single contributor to this report, and we hope it has the effect that it really deserves to. Thank you.
Thank you, Helen. And I guess I'll just hand over to Vicki as well from the GDI Hub, just to see if you've got any final reflections as well before we summarise for the day.
Thank you very much to everyone. Huge thank you to Louise. It's her last day with us for a while. Thank you. And I suppose I'm just really interested in the national, but also the international themes that are emerging in the chat and in the questions and answers. And so from my point of view, I think we will not only continue to lobby and influence UK government and funding agencies and universities, but also I'll feed some of the themes that I've heard today into the work that we're doing with the World Bank, which is scoping international interventions on inclusive education too. So thank you very much to everyone for participating. It's been a really interesting and useful hour, I think.
Wonderful. Well, thanks so much, Vicki. So that's about it from us today, because we've already gone over time. So apologies we didn't get to or the Q&A. It's been fantastic to have you all join us today and to hear all your reflections. We will be making a transcript and a recording of the webinar available as well. So if anyone hasn't had the opportunity or missed sections, then you'll be able to go back and see some of those. And we'll also provide an update kind of after the session, just for more information on how you can get involved, and also around the development of the Disabled Leaders Network as well, as we'd love to welcome you to that. So finally, really a huge thank you from me to Kate, who did a huge amount of work in pulling together the report, and the presenters today, Amelia, Phyllis and Lucy, for your excellent contributions. And it's been really interesting just hearing your reflections, and some really important points were drawn up there. And a big thank you to our BSL interpreters and our captioners for your patience and your speed in keeping up with us when we sometimes went a little bit fast. So apologies again for that. Thank you so much. Do check out the Snowden website for a bit more information on the opportunities for some of those grants. And you'll be hearing from us shortly. Thank you for joining today.